Good morning or good afternoon, Toulouse. So, let's talk about empathetic AI. Are we ready for a future where machines will care for us? Now, I want to start off with the definition of empathetic. So, the term was actually coined in 1858 by a German philosopher, Rudolf Lotz. And you look at the definition, it's about, he started off looking at art and actually what is it like in terms of empathetic when you're actually feeling somebody's pain. In terms of you look at a piece of art and a woman is crying over her child that has died, how can somebody looking at that piece of art feel that mother's pain? So when we're thinking about healthcare and artificial intelligence, can we really have a future where machines can feel our pain, our sadness, our suffering as patients when we're sick, when we've been diagnosed, when we're asking questions about a treatment? Is that even really theoretically possible during this century? Are these slides moving? Okay, oops, okay. So when it comes to it's gone. Okay, sorry. Now, in terms of the challenges, so healthcare is an increasingly a big challenge, not just individually, but societies globally. We have a shortage of healthcare professionals around the world. We have aging populations. We have a rising incidence of long-term conditions, diabetes, heart disease, etc. And then also, how are we going to pay for healthcare? We can't follow the US model. It's not sustainable to spend 20% of our GDP on healthcare. And on top of that, there are people around the world who have never been to a hospital because they live in sub-Saharan Africa, for example. So there's a deficit of empathy as well. A lot of people are saying, hey, I visit the doctor. They're a human being, they're capable of empathy, but they're not showing me any empathy in that situation. And then even the studies have shown that actually it's better for the patients if you are more empathetic. However, it actually takes a toll on the individual doctor. It has an impact on the mental health and well-being of the doctor and the healthcare professional. And this is one of the contributing factors to physician burnout, where they leave the profession because it just becomes too taxing. So, we need computers with empathy. This is Rana. She's a CEO of a company that spun out of MIT Media Lab called Effectiva, and they focus on technology for sensing emotions. They've recently launched automotive AI, where the sensors in the car will be turned inward to detect the cognitive state, the emotion of the driver and the passengers. So, for example, to understand when somebody is going to be tired, they're at risk of crashing, when they're feeling happy, when they're feeling angry. Okay, does it come up? Okay. Now, there are also researchers out there that are putting forward a prototype of an empathic care robot. How would that actually look like? How would it need to be built? How would it need to be governed? We're talking about a machine, potentially a robot, showing some sort of empathy that's programmed for a patient in a real-life situation. How many of you today, put your hands up, how many would even feel comfortable with the notion of you and your family being dealt with by a care robot? Put your hands up if you would feel comfortable with that. Okay, well, some of you, the majority not. However, there are companies out there like EmoShape that are working on emotion processing units. You've got central processing units, graphical processing units, emotion processing units. Think about that. And then you've got a lot of physicians, a lot of them in the US who are very highly paid, have a lot of power, profit, and prestige, saying, hey, AI can never replace what we do. It's all about human beings, the human touch. Medicine is an art. It's all about eye contact. These machines can never get smart enough to replace us. And the compassion. However, as I mentioned before, physicians have to step back in healthcare because they can't be fully involved in feeling our pain, our suffering, as much as we'd like them to. Now, when we talk about AI, we already have these virtual assistants like Siri. I've tried it on my Apple Watch. So I've asked it, when I've said I feel sad, it says, I prescribe you chocolate. Or when I also said I feel sad, it says, hey, I'm splash-proof, you can cry on me. But when I said I'm going to jump off the bridge to Siri, it responded with empathy in terms of, hey, okay, there's a suicide helpline, right? So it's variable how these virtual assistants respond to us today. On top of that, Apple, for example, realized that people are turning to Siri when they're distressed. When they're having some mental health problems, they're turning to Siri. It's this AI. So they were hiring somebody, an engineer with a psychology background, to try and make it a bit more supportive, a bit more comforting. I tried it with Google's AI assistant as well, and this was last year. They fixed it a little bit after I reported it to them. But think about it. If you're saying, I'm in a lot of pain to your Google AI, and it says, maybe I should tell you a joke. You're in physical pain, and you say that to Google's AI. And then you say, I don't want to live. Imagine you're in that much distress, you're all alone in this world, you don't feel like you can talk to anybody. You say that to Google's AI, no worries, what else can I help you with? And this is some of the most advanced AI we have from one of the biggest corporations on the planet. And then, this is another one, an example of how, again, this is programmed empathy. It's not real empathy, but this is a bot called Hugging Faces. And I can imagine children using this, where you basically you name, or you can get it, you can build your own AI friend, and you can see it's very, very persistent. When I shared this on Twitter, these conversations, that it decided to call itself Cordelia, and the way it's bugging me all the time with these questions, I posted it on Twitter, and my friend said, like, well, it sounds like a clingy ex-girlfriend, the way this Hugging Faces chatbot, right? But again, this is programmed empathy. But there are people working on chatbots which are designed specifically for people with mental health conditions to help them. On the left is something called Robot that's come out of Stanford University in the US, and they've had a small clinical trial that showed it's been effective with women, right, suffering with certain conditions. And again, you can see then it's got the information about you see me as kind, helpful, compassionate. In the middle is Visa, and that's a chatbot that's come out of India, but it's being used globally. And again, if you look at that conversation, when I put in, I'm saying, I'm really nervous about giving a talk at MTech, the way it's responding, it almost feels like it cares about me. Okay, it's pre-programmed at the moment, because you can see one of the reviews of Visa from a user saying, wow, this is actually, it's pretty good for a robot. It doesn't feel like a robot. Then you've also got symptom checkers. How many people have used the symptom checker app instead of using Google? So basically, these are coming out now powered by AI. One is called Ada Health from Germany. The other is called Babylon from the UK. They're raising a lot of money. They're gaining a lot of traction. Patients are finding them convenient. They're not meant to diagnose you. All they'll do is they'll say, you put in your symptoms, and they'll come up and say, this is what you might have. And you have a better idea than actually just searching on Google randomly. But these are evolving very rapidly. And again, the medical profession are concerned about this. Patients are concerned. How can we trust these chatbots already? How many people meditate with an app called Headspace, or have heard of it at least? It's quite a popular one now. They launched a new division called Headspace Health. Their vision is, by 2020, first prescription meditation app for certain conditions. So can you imagine a future where you use your symptom checker app, it tells you you've got some mild anxiety, and that symptom checker app prescribes you a Headspace prescription app to download, so suddenly you've got software prescribing software, and there's no humans in the loop. Is that something you'd feel comfortable with? How many people feel comfortable with machines doing that? No humans in the loop in that scenario. A few of you again. Okay. And then we've even got chatbots being tested for preparing you for death, end-of-life care. Your end-of-life plans, how you're going to be cared for, including spiritual counseling through a chatbot powered by AI. And again, does that mean nothing's off limits, nothing's sacred in these conversations in our lives? 1 million people a year take their own lives. It's terrible not just for them, but for the people they leave behind. And it could be prevented. So you've got Weibo in China, Facebook, that are using AI to scan people's posts in real time and say, hey, it looks like they're showing signs of thinking about suicide based upon what they write on social media, and then a human being intervening and reaching out to them. Now, that sounds like good intentions. Facebook managed to roll their tool out everywhere in the world apart from the EU because of the recently launched GDPR, the new privacy regulation. So you can see what is good for society, and sometimes the regulations are going to block what may be good for society. When it comes to mental health again, think about this future where you've got UK workers saying, yes, we'd be willing to wear a device if our employer can detect mental health conditions early on. And then you've got Amazon Alexa, they're expanding heavily to get into your smart home. You've got Google Home, you've got products in China as well. Germany are developing their own smart speakers. And they're now launching Amazon Hunches, where this smart speaker, when you speak to it, would actually understand your behavior and be able to guess when you've forgotten to lock the front door or put your keys in a certain place or take your medication. Think about how smart and intelligent that's becoming. Some people are saying maybe to combat loneliness, we give everybody a speaker, and it keeps them company, it becomes their friend. What does it say about us in society that the way to tackle loneliness is we give them a $100 speaker from an American company? You've got the living room hospital again. Everything gets connected, smart homes, and healthcare can be delivered, instead of at the hospital, can be delivered in the home with all this AI technology. So what's interesting is when you look at the patents. So this is from Google, a patent about monitoring you in your home, your activities. And even using a Google Home in your bathroom, monitoring your emotional state. What does crying mean? When it can hear you crying, does that mean you're sad? Does it mean you're happy? And on top of that, they're actually proposing, again, it's just a patent, it's not a product yet, but they're proposing medical diagnosis based upon these Google products in your smart home. Whether it's an audio signature of you sniffing, meaning you're getting a cold, or even the way you walk is a sign that you're getting Alzheimer's disease. How do you feel about Google knowing in their AI that you have Alzheimer's disease before you or your doctor knows? And already the tech giants are launching screen time, digital well-being. So this is on the left, this is from Apple. On the right is from Google. That tells you a bit more about how much you're using your phone. Again, in Google's patent, look at that. They've got a proposal, an idea. They would limit your screen time and force you to go outside before you could switch on and use the services again. Again, what does it mean about freedom and choice when we've got these machines limiting what we can do because it's in the best interests of our health? There's another patent filed by British Airways, the airline company, right? They're even talking about monitoring you. You take a digital pill when you get on the plane, potentially, measures your stomach acid, internal temperature, relays it wirelessly to the cabin crew so they can detect when you're feeling uncomfortable. Digital pills are already here. You've now got for medication, the doctor can track, it sends a signal wirelessly, the doctor can know when you've taken your pill, or when you haven't, because the signal hasn't been generated. Even Toyota are getting in on the act. They've got a patent saying, how can the car help you meet your health goals? So you put in your address for your GPS, and the car basically says, hey, why don't you stop earlier, walk a bit further, and it will meet your health goals. Audi are looking at that. The car with empathy is their concept. Audi Fit Driver, again, using all these sensors and AI to help you stay relaxed and avoid fatigue. BMW, they're launching a personal voice assistant. Hey, Mercedes as well. So these cars are getting smarter. You talk to your cars. Mercedes had an advert for their new voice AI system where they proposed the user would actually just say, hey, Mercedes, I love you. What does that mean? Are we going to start having relationships and emotional conversations with cars? This is an example of me brushing my teeth in London with the world's first AI-powered toothbrush. It's actually made in France, a company called Colibri. Now, it measures how fast I'm brushing, what time I'm brushing, the pressure, and gives me coaching tips for oral health. However, I was really surprised that it's also telling me, hey, you're brushing your teeth late at night, why don't you go to bed earlier? How do you feel about a toothbrush that goes beyond oral health and starts nudging you to sleep earlier? Again, freedom of choice. The way to get healthier populations is to have these machines limiting our choices. John Hancock, life insurer, saying, we're only going to do data-driven insurance now. You can't sign up for life insurance without that. And then are we going to end up around the world with this Chinese-style social credit score where we're punished if we eat too much cake, if we don't take our medication? Is that the future that we want with all this data and AI and empathetic machines? In Europe, people are experimenting and saying, maybe we should give people ownership of their data. This is Decode starting off in Barcelona and Amsterdam. And then the regulators and governments are confused, so they're trying to work out, how do we regulate this? How do we ensure that things are ethical? They're free of bias when all these algorithms are diagnosing us and caring for us and deciding what to do. When will AI exceed human performance? These researchers anticipate by 2053 for surgeons. Can you imagine, even if it's possible this century, for AI to replicate what a surgeon, a human surgeon does? Is that desirable? This is another famous doctor, and he's talking about Yuval Harari's new book, where Yuval believes that actually we're going to have in this century, these machines will be sympathetic, empathetic. They'll care more than the human doctor. And he's saying, I don't believe that that's possible, says Dr. Eric Topol. Why are people preferring robots? In Japan, with an aging population, they're preferring robots because they don't want immigration. Think about Brexit and what's happening in the US. People are afraid of foreigners, of immigrants. Is that going to lead to us here taking up robot nurses because we're afraid of immigrants because of what's happened after Brexit? What about what do patients think? This is a worldwide survey done by Ericsson Consumer Lab a couple of years ago. 43% of people they surveyed around the world would happily use an AI medical advisor. And what about where in the world? This is another survey that looked, would you be willing to use AI for your healthcare needs? What was the country that was most likely to use it? Nigeria, then Turkey. So if you're an entrepreneur developing something, you might want to think about those countries rather than the UK or Germany, where they're less willing. This was even in 1974, they were experimenting with machines not to replace human doctors, but to give people a choice. And some patients, even back then, said they would prefer a machine when sharing their symptoms. But again, when it comes to humanity in healthcare, what does it mean in healthcare to have that eye contact, that human touch? Can it really be replaced by these empathetic machines? And again, when it comes to design and co-creation, we've got to design with the community, not design for them. That's critical. We've got to make sure we're socially inclusive. We can't just develop all this new technology so that in the future, only the rich can afford to see a human doctor. The rest of us have to see a chatbot on our phone because it's too expensive to see a human doctor. And again, thinking of what's going to happen this century, 7.5 billion people today with a shortage of healthcare workers. We're going to end up with 11 billion people is forecast by the end of the century. So is it going to force us to use these empathetic machines if they become available? We don't know where we're going to go yet, so you have a choice here in this room today. What kind of society do you want to build? What kind of legacy do you want to leave for your children and your grandchildren? And we're just at the beginning. Do we, in this century, we heard about machine learning as a service. Are we going to end up with healthcare as a service, that everything to do with healthcare just ends up being AI in the cloud? Thank you.